Welcome to Medical Matters, keeping you informed on how GMC is transforming healthcare. Hi, I'm Andrea Wehrman, and in this edition of Medical Matters, new cosmetic trends to invest in your inner self, and how home runs in healthcare pair up. It seems like every story you hear in the media nowadays links the economy to why you shouldn't invest in a particular good or service. But enough already. Isn't it time to invest in yourself? The women I'm about to introduce recently came to realize that an investment in oneself is a way to renew their spirit as well as their appearance.
I work a ton. I do home renovations, and so I just needed a renovation on my home right here. And I just needed something to help me feel more confident and just get my body back in shape.
I had a hysterectomy back in 1990 and had, of course, the hysterectomy scar and a little saggy skin over that, and had gained weight.
I had twin boys and gained about 68 pounds all in my stomach, and have spent 6 years trying to get my pre-baby body back.
All three of these women have different stories, but one common denominator.
I think relative to the economy and cosmetic surgery today, you still see women who care about themselves, who want to look good. They're the same people that go in their closet that want to put on a nice pair of slacks and a blouse to look good in the community. The same applies to surgery. It's a competitive world, and people want to maintain and be able to compete.
And when these women invested in themselves, they saw more than just changes in the mirror.
I'm feeling great. This is my first week where I'm actually up. My activities are pretty much back to what they were. So I've got another week to 2 weeks before I can work out again, but for the most part, I feel good.
It's been amazing. It has given me a boost of confidence to be able to maybe dress in a little more trendy clothes or things that would make me feel better about myself. I am in sales, and it just kind of made me feel a little more competitive with other women that are younger than I am.
In this world, impressions do mean something. I once had a patient tell me that when she lost 20 pounds, her IQ went up 20 points. The reality is, to be given a shot, you have to make a good first impression, and that good first impression is important.
I was more focused whenever I healed, and I just felt more productive and just felt better about myself. And I think, as with anybody in sales, the better you feel, the better you go out and present yourself, and the more sales you'll probably get.
A new look, sense of confidence, and even money in their pockets. The results from an investment in oneself. We also got to talk to Dr. Whiteman about some of the new trends in cosmetic surgery.
I think the biggest growth area is wrinkle management and office-type procedures. Things like Botox for dynamic wrinkles, crow's feet, frown lines, fillers to treat static wrinkles, wrinkles around the mouth, lips, etc. And then actually in the last couple of years, the return of silicone gel breast implants.
Other advances in plastic surgery are fat transfers, which means that fat from one area of the body can consistently and safely survive as it is transferred to another part of the body.
I think that what we're going to see in the future is the growth of fat transfer. There's always been this wish to try and see, can I remove some fat from my thighs and put it in my breast? The reality is right now would be considered somewhat experimental, but what we need to further understand is how fat transfers work, how to increase survivability of fat, and we're starting to do more cosmetic procedures, fat transfers to the rear end, fat transfers to the face, and once we get the techniques down and we clear and make sure that these things are procedures that are reliable, then you may see advances into the area of the breast.
These advances lead to quicker results and allow us to not miss a beat in our daily activities. As one of Gwinnett's leading plastic surgeons, Dr. Whiteman does more than breast reconstruction. He also has a passion for giving back to breast cancer education and awareness in the community.
Supportive giving has risen in terms of the foundation donations. We're very influential in actually directing money towards breast cancer. The hospital itself raises funds in general, but we have a specific need, and that is breast cancer within our community.
The sport of giving originated right here in Gwinnett County.
Well, it started back 9 years ago in remembrance of my mother, in honor of her. and it started out of my discipleship program. And I just had a passion for the Lord and a passion for tennis, and I thought it would draw women together for a great cause.
The Sport of Giving is in its 9th year of promoting the cure for breast cancer through community sporting events.
I think the Sport of Giving really has given the women in our community a chance to give back where they can see the result. And we especially are proud of Gwinnett Medical's involvement to be able to provide the very best medical services that our community deserves, quite frankly. So we're really proud of that.
Women coming together for a common cause helps not only breast cancer research, but healthcare needs right here in our own backyard.
Gwinnett Medical Center became the object of our fundraising. We were so fortunate to find that need, and they already had places, the foundation in place that had needs for the funds. It was a perfect fit.
The program has been expanding incredibly. The primary goal is to raise funds for breast cancer awareness within our community itself. We have purchased mammography vans. We have completed diagnostic mammography centers, screening mammography centers. We'll be funding a navigator to take people through the process of, if they were diagnosed, how to get to completion.
In the past 9 years, the Sport of Giving has donated over $1 million to GMC, and each dollar leads to more life-saving opportunities.
I think it's such a milestone that a grassroots organization can be able and blessed enough to give $1 million for such a great cause that we're just thrilled, and we're just going to keep on going.
And it's no surprise to these women just what their generous contributions are doing for the community.
I think that's one of the strengths of the Sport of Giving is communication, and they really don't just say, come out and help for a good cause, period. They say, this is our cause, it's breast cancer awareness, this is exactly where your monies are going to.
Some of the Sport of Giving funds have also helped support the new Center for Women's Diagnostic Imaging at Gwinnett Medical Center, Duluth.
This center is just going to be amazing as far as offering customer service to our patients. It will give a spa-like feel.
The relaxing environment, all digital technology, and full continuum of care for breast health services are a recipe for success.
We offered new services over here to Duluth because we have patients that love to stay and start with their screening mammogram and have their diagnostic mammogram, and they want to come to the same place.
Now women have a comfortable place for all of their breast care needs. A big thanks to the Sport of Giving for making this dream come true.
I have been fortunate to be involved with this organization and with Gwinnett Medical. It's good for me to know that, we're working on having the best care possible right here in our county.
Whether you're a sport lover or want to help a good cause in your own community, the Sport of Giving is for you and asks for your involvement. To find out how you can get involved or to make a donation, please visit thesportofgiving.org. May is National Stroke Awareness Month, but here at GMC we celebrate stroke awareness every month.
We take care of the full continuum of care. We have our emergency department that is just great at recognizing stroke symptoms. Our neuroscience unit have also specialized nurses. Many of them are credentialed in neuroscience and have special stroke education. And then we also have our own rehab facility that is stroke CARF certified, which there's only a few in the state of Georgia that obtain that certification.
GMC is also the recipient of the Get With the Guidelines Award from the American Heart Association.
There are 7 key measures to ensure that a stroke patient gets everything they need while they're here in the hospital. And we have met 85% or better on those 7 measures for over 2 years. So we received the Gold Award for stroke.
What the award means is we're basically getting an A+ in all the parameters of how you would treat stroke victims. And what that means is that people are being trained and educated to stop smoking, their cholesterol, if it's elevated, is being treated, their blood pressure is being monitored correctly.
GMC is a highly recognized stroke center, and although we are ready to care for you and your loved ones, we want you to be prepared when faced with stroke onset symptoms.